Well, thank you, everybody. Thanks for inviting me to give this talk. I am Dr. Sola Oguntulu. I have been in practice in the United States for about 30 years. My primary specialty is in internal medicine, but I've focused more on the subspecialties of pulmonary disease, critical care, and sleep medicine. It has been an honor to get invited to give a talk to the team. As you're all aware, the healthcare costs in the United States have become almost unmanageable. The projection is, as of 2025, $4.9 trillion in health expenditures. That's with a T. Or if you want to put it another way, it's approximately $15,000 per person, and that represents a 17.6% of the gross domestic product. Regardless of who you are or where you are, that's a sizable expenditure. And it doesn't end there. There is projected to be an 8 to 9 increase year on year. So clearly there is a need to bend the curve. And there's also the need to explore innovative strategies to bend that cost curve. We'll be talking about efficacy, value, outcomes, and patient satisfaction, because at the end of the day, that's why we're here. So enter Dozee and the concept of ballistocardiography, which I'm sure you're all aware of. It's a paradigm shifting concept with applications across many healthcare delivery silos. I got introduced to the founders and the people running the company, and I was immediately taken with it. They had a vision leveraging technology that has hitherto been around, but nobody was able to process, let alone make applicable. They have been innovative, and the more I talk to the company, the more I'm involved with them, the more I see what was possible. I have become a consummate believer in what they're trying to do. Their belief, their resiliency in a world of uncertainty, adapting, pivoting where necessary, and navigating never before explored frontiers is actually extremely inspiring. The concept of ballistic cardiography itself is, I think, very elegant. And they have a differentiation in that it's contactless. It's a superior technology with multi-function product package. I believe they're actually the only company in the world that are looking to deploy that. So we need to have a lot of collaboration, a lot of synergy to achieve not just patient and healthcare outcome success, but also financial success. If you imagine this, there are 37 trillion cells in the human body, each one a universe of molecular machinery that we're just understanding. Now, in this audience, there are people who, as we speak, starting with the founders, are rewriting the instruction manuals on harnessing the signals from that remarkable machine, the human body. Sometimes crazy ideas are just early truths. If you think about when the founders started with this vision in 2015, I'm sure there are a lot of doubters, naysayers, and people who just did not understand the concept. Let it sink in again. The work being done here is literally reshaping what is possible. Welcome, everyone. Let's talk about what we're building. From contactless remote patient monitoring to fall prevention to pressure ulcer prevention, resulting in provider efficiencies, sleep diagnostics, and many more applications that are still in investigative stages that are advanced. I have to congratulate the founders, the amount of work they've done, the patents they've achieved, the certification through the FDA and the European regulatory bodies. We are the right team attacking the right problem at the right time to transform the entire healthcare field. I believe that profoundly. Imagine the day when somebody in a remote area who has little to no access to healthcare is able to be monitored real time as if it's in a tertiary institution, or diagnostic tools being deployed to diagnose hitherto very difficult to diagnose diseases like obstructive sleep apnea. That is what this company is doing. It is the only company positioned to do this, and you are all a part of it. Let's remove obstacles, support each other, fine tune the vision, and have a total commitment. Like I tell my younger colleagues, students, fellows along the way, you have to stay curious, stay hungry, and focused on what matters. And to my colleagues, step into the arena. Let's embrace the vision to deliver the change that we crave. Everybody knows change has to come in the healthcare system. We complain all the time. We are the players in the arena. We can see what can be done. Well, Dozee brings along with them tools to allow us to make those changes in a very innovative way, delivering value, cutting costs, and bending the cost curve. It's an honor to build this with you. Thank you all for choosing to be here, to take the risk, and to do this hard work. So now let's go and make history.